Hello, welcome to my channel. I'm Dr. Erickson. I am a specialist gynecologist as well as obstetrician. Today, we'll be discussing early pregnancy loss slash miscarriage. Miscarriage can be defined as loss of pregnancy or termination before age of fetal viability. Fetal viability means that at age, if baby is delivered, have good chance of surviving. Meaning that once a baby is extruded before that age, chance of survival is low. One worrisome thing is that a lot of people take miscarriage lightly, but the grief, the pain for the woman that lost a pregnancy, no matter how early is it, looking at all the expectation, is enormous. Now, that put into the mind and worries, can it be prevented? What causes this miscarriage? Now, if you look thoroughly, there are sometimes you have reason why a miscarriage happen, but half of the cases, or half of the people that have miscarriage, there may not be any identifiable reason why the miscarriage happened. For those miscarriages in which there are identifiable cause, it's also important to address those causes that you can modify, treat, or amend to prevent further occurrence in subsequent pregnancies. So, what are the possible causes? The possible cause why a woman may have miscarriage ranges from a woman that's having a baby that's genetically abnormal. The nature of getting rid of genetically abnormal babies, and that's happens to be through miscarriage. Such abnormalities ranges from chromosomal and living the hyperfloating world, such as microdeletion, but I don't want to bother with those medical journals. But the fact is that in such cases, whereby there is suspicion of genetic abnormality, testing for that genetic problem may be important. In subsequent sections, I'm going to explain further about how a woman that has genetic problem for miscarriage is going to be catered for. Now, other things that can cause miscarriage can be infection. There's some infection that can have effect on the uterus. Such ascending infection can cause some inflammation, which may make the uterus to contract and maybe getting extruded. Even systemic diseases such as diabetes, mellitus, then some other form of diabetes that occur in pregnancy in a woman that not been diabetic for the first time, known as gestational diabetes. Hypertension is another reason why a woman may have miscarriage. Now, the important thing about these causes I mentioned is that they are modifiable. So, proper control before conception through what we call preconceptional care, whereby we modify the possible reason why this will happen, is important. Other reasons why miscarriage may happen may be due to drug. Some women taking Utano that are taking it, and they may be taking some drugs that are harmful for the pregnancy. And end of the day, the drug might lead to them losing their pregnancy. Not because they knew that it will cause that, but that's why it's important that for every woman that's pregnant, don't access roadside drug from the chemist, because it lies in the table of an obstetrician to know the drug that is appropriate for a woman that's pregnant and the best for her to take. Other cause why a woman might lose her baby have to do with what we call autoimmune diseases. These autoimmune diseases include antiphospholipid syndrome, systemic lupus erythematosus. The word seems so heavy hearing that, but simply, what does it mean? It means that the body is producing antibodies. Antibodies are soldiers within the body that fight infection. So the antibody sees the baby as a foreign body or something that's foreign to the body and mounts reactions, which may lead to the woman losing her baby. Okay, so now the question is that there's some situation whereby some women have what we call recurrent miscarriages in early pregnancy. When a woman have recurrent miscarriage in pregnancy, it may be due to, as I explained before, these autoimmune diseases, and it may also be due to the fact that the mouth of the womb, which is the cervix, is not having good integrity to hold the pregnancy. This is exhaustive of different causes. There are several other causes, but I'm just trying to mention the most common one. In terms of grading, research have shown that 50% or half of miscarriages may not have identifiable cause. Out of the remaining percentage, about 1/4 may be due to chromosomal abnormalities, while others may be regarded to other causes I mentioned. And it's important that a woman that is having pregnancy loss, there are some things that may happen before the pregnancy loss occurs. Now, that brings us to the concept of what we call threatened miscarriage. Threatened miscarriage, in the sense, is like a pregnancy that is threatened. And what does it mean? So, women, before they lose their pregnancy, they start having bleeding and lower abdominal pain. At that point in time, the baby will still be viable. And at that point in time, some series of treatment modification may help prevent pregnancy from being lost. So, prevention. How do you prevent miscarriage from happening? That's a very big question. How this can be prevented include one. For a woman that has miscarriage before, in the subsequent pregnancy, before she takes in, she will have what we call preconceptional care. What does it mean? Preconceptional care is a period about 3 to 6 months before someone that have an underlying problem takes in. Is a period whereby those health condition is improved, so as to ensure that the health condition does not have a negative effect or adverse effect on the pregnancy. Let me give an instance. For a woman that's having cardiac disease, I don't think a woman having cardiac disease may have problem with oxygen that have entered the body, being circulated throughout the body. And the fetus inside the womb need that oxygen to survive. When there is what we call hypoxia due to that cardiac abnormality, can lead to the woman losing her baby. So such a woman with hypertension, cardiac disease, diabetes in pregnancy, in the period of pregnancy, or having a diabetes mellitus, modifying, treating, giving appropriate drugs may help prevent miscarriage. And someone that is on chronic drug, some people are on antihypertensive, which are ketogenic. That means that they can affect the baby formation and they can harm the baby. Such drugs should be stopped before pregnancy. So when you talk about prevention, it has to do with first, primary, secondary, and tertiary. So as explained earlier, is the primary prevention. Secondary prevention has to do for the women that are already pregnant and expressing early signs that the pregnancy may be lost. What can be done? Include bed rest. Then if the person is involved in strenuous activities, such as having a strenuous work in the office, a work that demands physical exertion, there should be modification of that occupation or job. Then another aspects involve use of certain drugs. There are some certain drugs that can be given to make the uterus less contractile, more or less quietly the uterus. Because if the uterus is contracting, it can lead to the expulsion of the baby. Though there are some controversies if the drug have really helped or not. But majority of literature or majority of doctors that have used that in part have shown that it is helpful. So prevention of miscarriages, as for those that have modifiable factors, we include one, reducing stress during pregnancy is important. If you have any form of infection, prompt treatment, as well as for those that have genetic abnormality, finding the best methods, visiting a geneticist and a doctor that is an expert in fetal medicine is important. So it's important, as I mentioned, some part of prevention. We have known some possible cause. Sometimes we don't know cause why miscarriage may occur. But for in general, every pregnant woman should reduce stress, as stress has been known to be contributory to miscarriage. Then another thing that should be done is that for those that have some medical condition that can affect pregnancy, it's important that such medical condition should be treated by a well-trained doctor in a good hospital. Then also, for those that are experiencing low abdominal pain, spotting before it gets worse, or before you get at a period whereby the pregnancy loss cannot be prevented, it's important to address it early enough in order to prevent early pregnancy loss or miscarriages from happening. I may not exhaustively discuss everything because it's a very, very wide, broad topic. But if you have any question, please visit the comment section. Feel free to ask your question. We are going to address the question. For those experiencing the symptoms or the condition as explained before, it's important to visit your doctor promptly. If you need any further guidance or information, please also, you can just please like our video, subscribe and share. We will see you next time.